Good morning, or good afternoon. It's 12:30. I'd like to take this opportunity to welcome you all to the school board workshop this Tuesday, August 18th. Dr. Aspin, I'll turn it over to you.
All right. Can you hear me? Red button is on.
You're very low.
Testing. Testing. Woo, there we go. Yes. All right. Well, thank you very much, and good afternoon, Madam Chair, board members. It's good to see you today. We do have two items today. One is an update on our reopening plan, and the other is to discuss our face mask policy. Before I begin, I just wanted to take an opportunity again to say thank you to everyone. I know this has been my first week. I mean, into the second week, which is fantastic. It's been wonderful, and I just want to say thank you to you and all of our district personnel and our school personnel who I have met, and the warm welcome that I've received, and the kind words. It's been fantastic, and thank you again for showing kindness during the swearing in to my family. I really do appreciate that. So again, thank you for the opportunity. So our first item has to do with our reopening plan, and wanted to give you a quick update on that. And first of all, I wanted to say thank you to our parents and our employees and our community members, business partners, our healthcare workers. A lot of folks gave input during this time when we were creating the plan. Also I wanted to mention you as board members. I know that you're making tough decisions, and you're receiving lots of emails and calls on a daily basis, and you know, I know your job in the school system is really trying to overprotect our kids, our students, and our employees. And I know it's a tough job. And I just want to say that I think you are making good decisions, trying to have our school system be as safe as possible, without hindering physically, mentally, or even instructionally. And trying to walk both sides of that line is very difficult. So I commend you for trying to make our school system as safe as possible, but also continue our quest instructionally. But I will say, and I think you know this, we have 2 weeks to go, and it is time. It's time for us to complete our plans and to move forward and begin the implementation process. And I think we all, it's new to everyone. We all need to come together. We're going to have obstacles. We're working through all those. But at this point, moving forward positively together and implementing our plan together with fidelity and overcoming whatever problems and obstacles, creating solutions is definitely what we need to do. So I'm going to go through the plan just from an overview, and then when I get to the end of that overview, we will have a PowerPoint as we did at the last workshop, I believe, and we will have new numbers on those slides. It's only about 8 or 10 slides at the end. So first of all, we had our emergency order that came through from Tallahassee, as you know, July 6th. We had a plan before that. We had to modify our plan. We had much input in that, and we ended up, we have a face-to-face option for our students. We have a school-based remote option, full-time virtual option, and a homeschool option. And right now, 70% of our students, or 25,000 of our students, will be in a face-to-face situation. Our school-based remote remote will be made up of 28% at this point, which is around 10,000 students. Our full-time virtual is at 1%, with 440 new students moving into virtual, and then our homeschool is at 1%, with 479 students who will move into the homeschool situation. So our priority, obviously, is safety first. First and foremost, safety for our students and employees. And again, I want to thank our district leadership and their teams for the amazing work they have done. It's unbelievable how much work they have done, and they're doing such a fantastic job. And they're basing all that on input. And input has come in from CDC, the American Association of Pediatrics, our Department of Health, and Sarasota Memorial Doctors. We have talked with Michael Drennan of the DOH and Chuck Henry of the DOH weekly. And we had another discussion with Dr. Gordillo from Sarasota Memorial Hospital. He's our infectious disease specialist. And I just want to mention that they are on the line today. So if you have questions as we go through, please feel free to call on them. They have been wonderful. We've worked really well together with our teams and with them, and I want to thank them for being here this morning or this afternoon. So far, we have purchased over $1.7 million in personal protective equipment, including masks, face shields, desk shields, hand sanitizer, and cleaning products. And we also have purchased antimicrobial spray, and I want to mention that because that is spray that we can spray throughout our schools, and it lasts for 90 days. It kills the virus for up to 90 days. So we will be spraying that if we haven't already, and then we will come back probably at the 70 to 75 day mark and just do it again to make sure that we are killing any of the virus. When that virus hits that spray, or those surfaces, the virus dies instantly. So I just wanted to bring that up, that we are doing everything we can to keep the schools and our places of work and education clean. We have cleaning procedures that all of our custodians are going through, and our teachers, and basically all of our employees, so that they understand. We have nurses at each and every school to help us respond when we have cases or symptoms. Also, we have a COVID response person at each school, and we have a COVID response team at the district office. And in a few minutes, Jody Dumas will take us through that as far as different scenarios regarding the COVID positive tests and those who have symptoms, and what we will do in those cases. We have moved custodial shifts, some custodial shifts, from nighttime to daytime in our schools to help us during the day when the students and the employees are present. We started training this week on what to expect, not only with safety, but also with instruction. We began training our custodial staff, our bus drivers. Our bus drivers, for instance, they'll be cleaning our buses and spraying them down in between runs. Our food service folks, they are going to help us with our remote learners who will be picking up food, as we did at the end of the year last year. We also are looking at additional lunch periods at some of our schools so that we have less students there all at the same time, and then spread out the distribution locations on campus to make sure that our students are spread out as much as possible. Our substitutes, we will be training them on the 27th. We have 400 substitutes who are on our list, and it's a good list of 400, and they will be trained on the 27th. And we will hire 1 to 2 substitutes for each school to start the school year, and we will have them on board for the first 2 weeks, whether we need them or not. So a principal will have that person there ready to go in case the need arises. And I want to thank the board for funding that as well. We also have our training for our teachers and what to expect as far as cleaning inside their classroom, or what to look for with their students. And then also this week, with their 5 days of training that you gave them, they will be working on instruction. And then next week, they'll go into pre-plan, where they'll continue working on their instructional delivery and working together in their PLC groups. The principals and the school leadership teams and teachers have worked tirelessly over the summer, and they have created plans for their unique school situations. As you know, each school has a unique environment, and there are certain things that they need to do as far as creating plans on campus. Principals have revised student schedules, they revised teacher assignments, and all of that was based on the parent information that we received, whether their student was going to be face-to-face or a remote learner. So the principals and their leadership teams have really spent quite a bit of time basically going through their entire master schedule and rescheduling their schools in about 3 weeks, which is really difficult, but they are doing it, and they're doing it well. So I commend them for that. They've also created procedures and protocols for arrival, class transitions, lunches, dismissal, all very, very important on social distancing. And like I said, each school has unique challenges. They've done a great job with that. They've included signage and reminders around schools for teachers and their students so that they know what to do, where to stand, where to go. They've also looked at staggering times possibly in between classes so that everyone's not out in the hallways at the same time. They've communicated very, very well with parents. And one thing I want to mention to parents is please communicate with your schools during this time, especially with your teacher. When you have your teacher and you know your teacher and your class may be 18-1, the best way for you to communicate is through your teacher, and your teacher will find that answer for you or help you, and then we can support you there as well. So in addition to safety, we need to look at academics and instructional delivery. That is our focus. That's why we are here. Number one priority, safety, definitely. But we need to make sure that we're focusing on teaching and learning coming into this school year. So we are looking at our concurrent instructional delivery, in which we will have teachers will have students in front of them and remote, and we have the little cameras and the audio enhancement that we will be using, and the teachers are training on that this week and next. We also are looking at the summer slide. Every year we have this summer slide, and you try to work through that, especially when students are transitioning from one school to the next, or just, like I said, going from one grade level to the next. We need to look at that and the COVID slide, basically, from the end of the school year to see where we need to help our students. We need to be looking at the achievement gap. We need to look at our subgroups. We need to make sure that we are paying close attention to our rigor and our pacing so that we can stay on pace throughout this school year. The concurrent instructional delivery is really going to help us with that, since our remote learners will be able to stay up with those who are in the classroom. And when those remote learners are ready to go back to the classroom, they will be on pace with everyone else in the classroom, and they will already know who their teacher is. So that should work out really, really well. And I commend the instructional and the academic staff for that great plan. Also, our social emotional learning, we need to pay close attention to that. And then our counselors, especially with our mental health efforts, face-to-face and remotely, which we will be able to support our students and our teachers through our counselors. Computers for our students as needed. We've spent around $4 million to be sure that we have enough computers for our students, and it's not one per family, it would be one per student, since we are trying to make sure that our students can stay up with their individual classes and go through their day. Even if they're remotely, they'll be able to go through their day as if they were in school. So each student that needs a computer, we will be able to support that. And then we created videos for parents. I know that you've seen a few of those. We have a couple of new ones that we want to show you today as well. These videos are out on the web page, and I encourage all parents and employees to please, anyone in the community, please watch those videos. They're very quick, 3 minutes. And they talk about all the different topics that we have as far as opening school once again. Those topics, just so you know, those topics include PPE, cleaning, instructional delivery. We have a transportation one, and we have a food service one. And like I said, there's a couple that you will see you will see today. So with that, I wanted to stop here and bring the PowerPoint up, and we have a few different folks here who will speak to the slides on the PowerPoint. You know, Jody Dumas is the Chief Operations Officer, has done an unbelievable job, and so has Dr. Kingsley, our Chief Academic Officer, and their teams. And so I'm going to turn it over to them. I think we have 8 or 10 slides, and they can talk through those. So if we could.
Thank you very much. I appreciate it. And so this first slide is a slide that you've seen a few times, which is kind of where we are as a community. So I would ask maybe Chuck Henry or Michael Drennan if you could talk through kind of what you're seeing in our community for transmission rates and what that might mean for us at this point in terms of transitioning back.
Unmute, Chuck. Mr. Henry.
Sorry about that.
Okay.
I'll start out, if that's all right, and then I'll turn it over to Michael. You know, this slide reflects the information put out by the Department of Health following positivity rates for children. And today's number is 8.6, but that's a cumulative number that looks at August 4th through August 17th. And so that's coming down. I think last time we looked at it, it was a little over 10, and that's encouraging to me. Right along with that, and Mr. Drennan will talk more about that data, is our overall community positivity rate, which is an important factor when we look at whether it's opening schools or opening other businesses. And our 14-day average there today is about 5.5%. And within that time frame, I wanted to point out, many of you have seen in a newspaper, we have been experiencing a little bit of a outbreak in our jail. And so if I take those numbers out from all of the testing that's gone on in the jail and look at really what's happening across our community, the overall positivity rate for the last 14 days is 4.5%. And so those are really encouraging numbers to me. And again, they just reflect where we're at now. We need to continue to watch this on a daily basis up until school begins, and then after school begins as we monitor what's happening. Michael, do you have any comments on the data?
Oh, Chuck, I think you did.
Could you hold for one moment?
Yes,
Jane?
ma'am.
Jane?
Excuse me, Mr. Henry, this is not children's. This is not data on children. Isn't this just the data on Sarasota County? I have that printout here. I have the positivity rate as of last Friday for children in Sarasota County at 10.1%, and that's only available to me weekly. Am I correct? Is this general population? This isn't children, correct?
So I didn't create this slide, but I downloaded this morning the pediatric characteristics for those less than 18 years old in Florida for Sarasota County, and that number this morning is 8.6%, which is why I presumed that's where this data came from.
Eric?
If we look at Sarasota County as a whole, you know, we try to look at the most recent data, and we look at 14 days specifically because that's the incubation period for the disease, and that kind of helps even the day-to-day elements out. If we try to look at the percent positivity every day, then you get factors in there such as how many labs are being reported, whether there's delays because of lab backups, or the number of factors of how many people get tested, or whether we're working a specific outbreak in a certain area. But over time, that tends to even out, which is why we like to look at it on a 14-day basis.
So I had some questions for Mr. Asplund, but I'm gonna concentrate my questions right now about the Department of Health. You talked about pediatric rates, you talked about the community rates, you talked about the community rates minus the jail. And so I'm gonna do a continuation of questions that Jane and I both asked at the last meeting. What percentage should we utilize to decide that we should be shutting down schools? And which one of these metrics, I'm gonna add on to that, which one of these metrics should we utilize?
So and I think Mr. Drennan spoke to this at the last meeting. We try not to focus on a specific metrics. We look at a number of different things because I think when you begin to focus only on a number, you lose sight of what's really happening across the community. So percent positivity is an important number that we watch. We also look at the rate of infections, new infections in our community per 100,000. We try to look at and understand of the infections we're seeing, where are they occurring at? Are they broadly across the community? Or what age groups are they occurring in? And then as school starts, of course, we'll be watching very closely what's happening across all the schools. And I think you have to look at, from my perspective, taking a public health approach, we'll look at all of that data and then from that derive recommendations on exclusion or non-exclusion, or whether or not we think the situation warrants excluding large groups like a whole classroom or more.
So let me rephrase my question then. If you had, let's take I understand it's a multivariable equation. If you had to take the 3 top weighted variables in this situation, what are the top 3 variables in the situation, and what would be the metrics of those variables? Because while you have to make a recommendation, we have to make a decision. And so it's helpful to understand what the metrics are ahead of time, rather than the sky is falling because something's happening, when we could communicate, no, that's just one metric. There's these other 2 metrics that are more important, or that metric isn't one of the 3. So we got to communicate to the public. We also have to make decisions. And I believe that last meeting you said that you were going to get that information last week, which was a week ahead of time. So that time is come and gone. So it's helpful for us to communicate to the general public and to the parents what if it's on the multivariable equation, what are the top 3 variables and what are the metrics of those top 3 variables?
Well, again, probably the top 2 that we're looking at is the rate of new infections in our community and the percent positivity. And there's subsectors within those. And the percent positivity data out there, WHO recommendations are that communities try to be at or below a 5% positivity rate for 2 weeks before opening schools. Michael could probably speak to the positivity rate. There's several different recommendations from different organizations out there on that, in terms of different thoughts. They're not as consistent as they are with the percent positivity. And Dr. Gordillo may have some comments on those as well. But looking at the percent positivity, I'm very encouraged at where Sarasota County is, and applaud the board for delaying the opening of schools until this downward trend could move and bring us down at or below 5%, because I think that becomes important as you consider reopening the schools.
5%. Thank you for answering my question.
Bridget?
Thank you. And thank you, Michael and Chuck, for being here, and Dr. Gordillo. One of the questions I had was, when you say, I know the pediatric rate, and just to confirm for anyone watching and for us here, I think you said 8.6%. Is that since testing began, or is that a 14-day or 7-day count? Average, I guess.
So that's, in this morning's report, that's reporting for the period of August the 4th through August the 17th, so a 14-day period.
Perfect. Thank you so much. And so I think going back to some of the metrics that we as a board have to determine on, again, I'll go back to Mrs. Corcoran's guardrails of getting some sense of, how do we evaluate this? One of the questions is, Sarasota County is pretty large, and so as we look, and I'm encouraged to see the numbers consistently decrease, and now being, as you said, just to confirm, we're at a 4.5% under a 14-day average for Sarasota County. That's correct?
If I take out all of the positive and negatives related to our jail outbreak.
Okay, do we have, okay, so.
Otherwise, it's 5.5.
Okay, thank you for that. So one of the questions I have, especially if we say from a macro from Sarasota County Public Schools, and we're looking at the aggregate data for Sarasota County and the percentages, some, as you said, the Department of Health is looking at where are they occurring. Is that data being shared with the district? Because at the current moment, we don't have the ability to test our staff or students. And I know that's been discussed before, but again, when you're trying to narrow in before making an assumption to close, if we go above X percent, how do we make that determination of where do we in fact adjust, close down schools, go to distance learning? Are you providing guidance on that, or is that a combination between the district and Department of Health making those determinations?
So I'll try to address some of those, and Michael, feel free to jump in, but a couple things there. Testing is widely available through private providers, and the state has 2 walk-up or drive-up sites open. I would say mid-July, there was so much demand for testing that those sites reached capacity almost every day. In some of those days, I think probably the biggest day we had over 4,000 results returned for one 24-hour period. Now we're closer to 1,000 on average, but neither of those big sites are anywhere near capacity. So, and there's not much of a wait, so people can go to those sites and get tested pretty readily, or use any of the other providers in town. Many of the drugstores are offering testing, as well as many private providers. In addition to that, the Department of Health has testing available, and we're in the process of working with the state, who just has expanded their capacity in all 3 of the state's big labs, the closest one to us being Tampa. So we will have the ability to move samples directly to the Tampa lab on a daily basis for a pretty rapid turnaround. So I would expect by the time school opens, we will not only be able to help the school employees and school board know where testing is available in the community, but also where the Department of Health can be accessed, so that we can expedite those samples if that's where people would like to be tested.
Perfect. And I think one final question on this moment is that I believe the Department of Health, when you do get those returns, and I know there's spikes for reasons over the weekend, and then there's a larger data pool, if you will, and that's why if you look at these graphs that there looks like a spike, but that's why you do the averages of 7 to 14 days, excuse me. But you also, is it correct, you guys do a heat map, if you will, so when you get that data, do you identify where that individual lives? I know we can't narrow down necessarily where they received it, but where there's a higher risk or outbreak, and I don't want to use that term, I don't know what the variable is from an outbreak standpoint, but I think my point is as we navigate, I think the entire board is safe to say we want to reduce the amount of volatility for our students and staff, and so when you are evaluating the data, if there's a certain region of the county that looks that it's peaking versus somewhere else, is that data that you can provide to us and that you're calculating?
It is, in fact, and we work closely with Sarasota County government and their Emergency Operations Center, and for several months now, we've been jointly producing a heat map. That's the correct term. The most current version of that heat map looks at the number of cases in the last 14 days and provides various shades of blue. The darker the color, the more cases, and gives you a number of cases for that are occurring in each zip code area. So it's meant as a planning tool for us. It lets us know, and the public know, where we're seeing the most new infections over that incubation period of the disease. And it also helps us ensure that we have adequate testing available for those areas that are experiencing a higher level of cases.
Perfect, thank you. And then I guess
certainly that can be shared, yes.
And then I was going to say, I would shift my question to staff, is that something we would be or currently monitoring or would be monitoring as we look ahead throughout the school year? Again, the county is long and large, and as we evaluate the data, utilizing the metrics that were indicated, is that something we would be looking at?
Absolutely. We get that on a daily basis from Department of Health and from the local emergency management department. So we get that number along with all the numbers that are going to the community. So we have that as part of our toolkit.
And is there anything that is in one region or area that is above the, or 5%, 10%, or is that something, again, we're looking at these numbers, 5% being the ideal below for a 14-day average. Is there any area of the county that's above that in that current heat map?
So Chuck, I'd let you respond to that question.
Okay, yeah, I don't have the map in front of me. I was going to ask Michael if he had it.
I wanted to follow up on that just a little bit. I don't have the map in front of me. I don't, to answer the question, I don't believe there are any zip codes currently above 10%, but I imagine there's a couple that are pretty close. I can't tell you without bringing it up and looking.
Okay.
With that being one tool to kind of follow up on the question about recommending school closures or recommending classroom closures, not only will we look at what's occurring in the county as a whole or even specific zip codes, while the bulk of testing currently is occurring in adults, and we don't have what appears to be a significant number of cases in children. That can obviously change over time. We would also be looking at the number of cases or the number of positives that we would be seeing from any specific school. So while the percent positivity for the county could be below the number that we want to see, and the rate per 100,000 could be below the number that we want to see, we're moving in the right direction and we're staying there, we might see a cluster or outbreak associated with a specific school, and we can make recommendations related to a specific locations as opposed to the entire district, which is one reason why we hesitate to set a specific metric. We want to look at a host of different things at the same time because, as you pointed out, it's a very large county. We may have different things going on in different locations, and we don't want to necessarily make a broad recommendation based on a specific number for the county as a whole. And we might see different transmission rates or different occurrence of illness in different locations or different schools.
Very good. Thank you very much. I appreciate it.
You're welcome.
Shirley?
If I could, Chuck, just one more comment on the heat map. I was just peeked at it to verify. The heat map tracks the number of new cases in the last 14 days by zip code, but we could not use that data alone to try to calculate a percent positive for each zip code because we don't know how many people within each of those areas got tested. And so in order to have a percent positive, we need to know how many total people got tested and how many of those tests were negative or positive.
Thank you.
Thank you again.
Shirley?
Dr. Henry, I want to thank you. I appreciate the time that you spent. It was well over an hour yesterday that we talked. Looking at this map that you have here, or this graph that you have, I know you're talking about that 8.8 being the last, would you say 7 or 14 days, but the language on it says Sarasota County positivity rate since testing began, 8.68. So, is this graph just for children that we're looking at?
So,
or is this all?
this would then reflect and all of the testing since March. If this is the cumulative number for Sarasota County since testing began, that is a number available to download. And again, I didn't create this graph, so it's hard for me to speak for sure, but that number seems accurate to me. We've been running right around 9% total since testing began. The state currently in their overall testing, we're a little over, probably close to 75,000 results that are being counted in that, maybe 77 now. The state's a little over 4 million, and they're about 13% overall as a state cumulative.
So is there a graph?
I obviously don't look at the cumulative number that often because it goes back several months and really doesn't tell me what's happening right now in our community.
Is there a graph that just shows the children, and is that number coming down?
I don't have it in a graph, but there is a report that shows, It's a table that shows residents less than 18 years old by county of residence and gives the last 2 weeks. And that's the one I was referring to that is 8.6 today.
Oh, that's what I think confused me, because you said 8.6 for children, and this map said 8.68, this graph.
Shirley?
One of the things that we had...
Shirley? Jody would like to respond.
So I was just going to clarify for Mr. Henry. So this is along with, I spoke about the toolkit from the emergency management team on a daily basis. This is part of what gets downloaded on a daily basis is this particular graph here, along with the heat map we were just discussing by zip code. So just to clarify.
The testing is the one area that I'm just very concerned about, and I'm glad, like you said, we've got a new lab up in Tampa, but especially for testing for children. I mean, we've got the R.L. Taylor Center, and just recently the UTC will do children, and I know that some of the private places will do children. And if you go to some of these drive up the drugstores, they basically hand you something and you do the test yourself. I'm wondering if there's any way that we could have our staff have hold of these tests to either hand it to or do it so that we get a faster turnaround on those tests, because I think if we can get them to the lab up in Tampa in 48 hours and get an answer, that would be helpful, because I know that if you go to the private ones, it may take a week or 2 weeks, and we've got all these kids sitting home for 2 weeks, waiting on tests, and so to do more testing would be almost futile, because by the time the information comes back, and I know that's something that I talked to you about, that we could look at using our staff or having certain places, like maybe the technical college as a place north and south that we could have them go to, but we definitely need a place in South County that's reliable, that parents can take their children to, or if we perhaps can just do it at the school sites, because we do have a nurse at all school sites. And I'd like you to work with our staff perhaps, and I've talked to them yesterday, and maybe we can do something like that, because I think that's a key piece to this. If we can't get the testing back and get those answers back quickly and make sure that everyone who needs a test gets that test in a timely manner, all of our plans, I think, will go up in smoke.
May I suggest that we ask questions and follow up for clarification, but don't do dissertation, because we will never get through with the two things that we have on the agenda today. Dr. Brennan, did you want to say something?
Just that we're working with the Department of Health on the testing piece, and we'll get back to you on that. We also have, as we continue through our PowerPoint, there's probably 8 more slides on there, and then we'll
Yes.
some of these questions might get answered as
So
we
we
go
have to
through.
move forward with the presentation before because some of the answers might be there, and if we keep reiterating, every one of us asks the same questions, I mean, it's not going to be helpful. So can you wait?
I need to ask something about what we're talking about.
Wait, Shirley, are you through?
Mm-hmm.
Jane?
I'll just reiterate, and I think you all explained this, but Sarasota County Emergency Management puts out a flash report daily. It has, by zip code, where the cases are. It has details on, this slide comes from that. The pediatric report is a every Friday chart that the Department of Health brings forward. On the end of July, Sarasota County had a 9.8% positive rate for children. Then we moved into August, and we had a 10.1 and a 10.2. So we're going up in pediatric cases. I think the most recent, because perhaps we're testing more, I don't know, maybe children are getting out more, but this is of great concern to me. 97% of those that will be in school will be our children. And so this is a very important piece to me every Friday. I can't wait until this is released to see if it's going down. It is not going down, it is going up. So I would just make that assumption.
It does not surprise me that it's going up, because as I drive by Burlington Factory on Cattleman Road, there are tons and tons of cars of teenagers there, and they have no masks on. They're just out partying. So our numbers will never go down until we get the people to change their thinking about how to prevent COVID or how to cut it and reduce it. So let's go on to the next slide, please.
So this is Mr. Henry, if I may,
Yes.
I'm just concerned about the statement, and I understand the data, but I just checked again, and on the department's public website, the pediatric report for today does list our percent positive for the period of 4 August to 17 August is 8.6%. And so we are starting to see that trend down, as well as the rest of our data. And I just want to make sure that's in the record, because that's where we're at.
Thank you. Here's the next slide. Brennan.
So our next slide is contact tracing, and Mr. Dumas is going to explain to you where we are with that.
So thank you very much, Dr. Asplund. So we've had a few changes. We've been talking about contact tracing now for a few of these meetings, and we've continually to work very closely with Michael Drennan and his team at the health department. And so we've made a few changes, and those changes are a direct result of some new information from the Florida Department of Health. They've provided just recently, just in the last few days, some additional clarification on what we're doing and how we're doing it, and then provided some letters that we are inserting in our process that come directly from the Department of Health, putting some credence behind what we're doing, what we're asking for exclusion with employees and with students in terms of COVID-19. And in terms of one of the questions we've been talking about is, okay, we've got contact tracing for positive COVID-19 and people who have been in contact with people who have COVID-19, but what happens if we're just sick? And so we've really worked hard with Michael and his team to figure all that out. So as we start to describe this and talk through this, it gets really confusing because of the exclusion timeframes and everything changes a little bit. So we worked as a team to put together this document, which you see in front of you on the PowerPoint today. And to me, I tried to put it in columns so I could understand it a little bit better. So hopefully this document will do that. I was going to walk you through that, and then I will talk about some of the changes in process as we talk through this document. So to me, there are two columns, and I would say the one to the left is people who feel sick. So I've got some symptoms, I don't feel right, but I haven't been tested, I'm not positive for COVID-19, but what happens? What happens when a student goes down to the clinic and has some symptoms? What happens if an employee calls in sick today? And so that's the left-hand side of this page, and so let's walk down through that as a possible scenario. So you have a person that's identified at school or work, or possibly stayed home today because of some symptoms. We have a new form from the Department of Health that every clinic aide, every nurse is going to have, and we're going to send to all employees that identify what are the symptoms of COVID-19 that you need to be concerning yourself with if you don't feel good today. And I'm going to run down through what those are. And this is one of the forms that we'll have out there, and basically there are a few symptoms that if you check one of these and say, yes, I'm feeling like this today, it's a red flag. So, for example, temperature 104 or higher, sore throat, new uncontrolled cough that causes difficulty breathing, diarrhea, vomiting, abdominal pain, or new onset of severe headache, especially with a fever. So clinic aide, nurse, employee has this in front of them and says, yes, I have one of those. The second part of the form, though, deals with community spread, and that we get information from the Department of Health, and right now we're still in the area where they would classify as significant community spread. So that's a box on the form, a secondary box that you check. If an employee or a student is experiencing any one of those symptoms and we're in a significant community spread still, then we're going to follow down that left-hand side, that left-hand column. They have to stay home for 10 days. Okay? So I'm sick. I've checked one of those boxes. I have a potential symptom of COVID-19, I have to stay home for 10 days. And so what we're asking is then if a student is at home and that happens, have the parent call into school and let us know. If it's staff and I've stayed home and I've called in sick today, call us at work and let us know that is going on with you. We've had a couple of those already happen. We want to make sure that we get that information back into the school. If a student comes down to the clinic, the nurse, the clinic aide will be running through this checklist with them and the parent, and they will be determining that right at school, okay? If they check yes, one of those boxes up top. If we're still in significant community spread like we are right now, the student and or employee with that symptom has to stay home for 10 days, okay? They, at that time, will get a letter from the health department, one of the official letters that explains this to them, why they're being asked to stay home for 10 days, okay? If you're in that category and you have to stay home for 10 days, you cannot return back to school unless you go and get a test, a negative test that would allow you to come back earlier than 10 days, or you go to your doctor and you get an alternative diagnosis. So you go to your doctor and they say, you know, you've got something else, it's not COVID, but you got something else and you can go back to school, or you could go back to work. You could return faster than that 10-day window, okay? If you don't do either of those, you got to stay out for that 10 days. And this is where the process changes a little bit, and we think it's a good thing in terms of protecting everybody back at the school site. So what we're going to ask is, once that 10-day window, if you're sick, once that 10-day window expires, or you've gotten the negative test, or you've gotten the alternative diagnosis, we're asking in every case for students and staff to call the health department and get a release to come back to school and a release to come back to work, one or the other. And so as these people transition or students transition back in, we will be looking for, do you have that release with you, okay? So again, I go to the clinic, I have a symptom, the letter goes home to parents, we'll identify on that letter, which comes from the health department, that says, here's the number of days you need to be out, here's the process. And then before you come back, you have to call the health department and get cleared to come back to school and come back to work. So left-hand side of the sheet you have in front of you, that's I'm feeling sick, but there are no positive tests of COVID. I haven't come in contact with anybody who has COVID. This is just I'm feeling sick and I got a potential symptom of COVID-19. Is that clear?
Shirley?
One of the things that isn't listed as a symptom is the loss of taste or smell. And, you know, I knew someone who, 13 family members got together, somebody was positive, and 10 of them, they did notice. That's why they noticed it, because they lost the taste or smell. 10 of them, and 10 of them, of the 13, were positive, and only one of them got sick, except for the loss of taste or smell. So I think that's a glaring omission here.
So great question, and I'm going to turn it over to my partners at the health department, because these are health department forms and their checklists. So Chuck or Michael, can you comment on that?
Sure, I'd be happy to speak to that. While it is one of the symptoms that we've seen in many situations, it doesn't appear to be a symptom that we see frequently in children, which is one of the reasons why I believe the state did not include that on this screening form. While that would be something we could easily add, I believe that is the reason why it was excluded from this checklist.
Well, I don't know how much different a 16-year-old is than a 24-year-old when you're talking about symptoms. You know, and I mean, is there a different form for teachers and staff?
The form's up on your sheet. Pull up your, Shirley, pull up your okay.
Yeah, so we gave you, on the right-hand side of your screen is an example of the form I was just talking about. And the left-hand side is an example of the letter that would go home with the student that says you had to quarantine or isolate.
So the letter or the checklist is part of there's a letter that would be used in the health room for students that would be coming to the health room, which is why those symptoms are placed there. There's also an opportunity to put other in the event they have symptoms that aren't consistent with the ones that are listed on the checklist.
Well, I just hope we do ask about the taste or smell, but I mean, absolutely, I think we should be looking at that in staff and maybe our older students.
So Michael, what I would say is, if it's okay with you guys at the health department, maybe it's one of the things we want to look at is just to make sure we've got a comprehensive list, and certainly we'll look for your guidance on that. Does that sound like a plan?
Yeah, of course. Well, we were going to make some small edits to this anyway, and so adding loss of taste and or smell would be easy to add here. That wouldn't be an issue.
Thank you.
Eric?
My question is more about Mr. Asplin's opening monologue, but it involves Jody Dumas. You mentioned that the teachers are getting trained on cameras this week. What percentage of the classrooms roughly have cameras? And then you mentioned the OmniShield, OmniGuard. How much of that have we gotten in, roughly?
So I just want to make sure I'm hearing correctly, and so Dr. Cantalupo, it's going to be 100% to start school, we'll have cameras in every classroom?
No, but he said this week we've been training on them, so I'm trying to understand, since you've been training on it this week, what percentage have them this week to get trained on?
So we have 1,700 classrooms this week outfitted with cameras.
Can we, I'm sorry, Eric. After you ask your question, let's, as a board, can we agree to at least look to see what's coming next? Because that might answer some of our questions.
My question was about Mr. Asplin's opening comments. Is that...
So 1,700 at this point in time. I know with training, you know, we have more than one teacher in a classroom.
So 1,700 cameras have been installed. Have been delivered and installed because they're being trained.
Correct. They're getting them installed, yes.
They're getting them installed?
It takes just a minute to deliver them to the classroom.
Okay.
Bridget?
Mine is on contact tracing. As far as so I thank you for clarifying because I had it highlighted. So if you have symptoms of X, that is in that check mark, and the 10-day, and you get a confirmed either negative COVID test or a waiver, I don't know what the right term is, from a medical professional, then you may be able to come back prior to the 10 days. And that's for staff and students.
That's correct.
And my question, though, is in the event, I worry that there are probably a handful of people, families, et cetera, that don't have access to a general practitioner. Is this something that the Department of Health is offering to families? What I'm concerned about is if there are families that don't have robust health insurance or don't have the financial means, and then they have these symptoms, rightfully so, from a protective standpoint, keeping them out for 10 days, but in the event they aren't actually COVID positive, I don't want to put them at a higher risk or from being removed from the classroom. So is the Department of Health, is it a general private practitioner that would be signing off on these particular releases, or is that something the Department of Health is doing?
So in all cases, before you return, no matter what your doctor said, they're going to get a release from the Department of Health that says they've checked through everything that you've done and you're okay to come back. But I think your question is at the individual practitioner level, for a family that may not have insurance, is there an option to then go to the health department? Is that your question?
Yeah, I mean, essentially, it's a private provider, then go to the Department of Health. In the event the family doesn't have access, I mean, do we have in our resources a place for them to go and guidance? Because I have to imagine there's a handful of families that would impact.
So, Mr. Henry, I don't know if you can comment on terms of your opportunity for families to come to your clinic?
Mr. Henry, are you still there?
I apologize, I forgot to unmute again. Yeah,
And I can't see you this time to tell you.
our clinics are set up to provide core public health services, which would include testing for coronavirus, but not set up for primary care. So that we wouldn't welcome them, wouldn't be able to welcome them as come see us and see a doctor and get evaluated. We can provide information on those organizations in our community, such as Center Place Health, Manatee Rural Health. There's a number of other free volunteer clinics where individuals with either no health insurance or limited health insurance can obtain services and actually obtain a regular primary care provider if they're in that situation.
Perfect, thank you. I would just think that, and from an information or communication standpoint, that we might want to include that so families know where to go in the event that happens. Thank you.
Shirley?
I'm wondering if they have to go to, or if they could call the health department after the 10 days and say, I no longer have this, and if the health department can just email or text them this, or, I mean, because it looks like it might be rather cumbersome for the parents. And when a person, when a child goes down to the nurse's office because they're not feeling sick, well, if they get sent back because they're not sick, but what if they get sent home? What happens then to the other children in the class when they start, when does this contact tracing start? When will the other children be told so that they don't go home and spread it to other children in the family?
Jody's trying to answer.
Perfect transition to the right side of the slide. So that's a great question. So if a student goes down to the clinic today with a symptom that we check the box, letter goes home to mom or dad or guardian, and again, they've got to work through the health department to get back into the class. At that point, nothing else happens with the class itself because, again, all we have is a symptom. We have no positive case of COVID-19. There's no contact tracing. There's nothing we would be doing. This is where communication is critical, though. If that student or that employee at that point then does get a test and tests positive, that's when we go to the right side of what you're looking at in front of you here and where we go through contact tracing for a known positive case of COVID-19. So let's talk through what that would look like. So let's take that scenario. So that student does test positive. They let us know. We go back into our process that we have set up right now. So obviously we don't want them to come back to school or back to work. We want the parent to call, in this case, back to the school and say, hey, Jody Dumas has tested positive. That would start our process. So the clinic aide or the nurse at the school would put that into our electronic process that we talked about that notifies the case manager. And that case manager then will work very closely with Michael and his team, and we met his team now. He's got 4 or 5 additional individuals we met yesterday who are working on our cases in the district. As they come up, they'll be there to assist. So our case manager, along with them, will do the contact tracing for that student, and that is going to be all hands on deck. So we will be talking to the teacher about what did class look like over the last couple of days. Where was this student sitting? One of the things we're encouraging very closely this year is seating charts so that we know where the students have sat in your class over the last couple of days. So that's going to be a conversation with this team, with that teacher or teachers or potentially bus driver about where they sat, where they were wearing masks, what did the interactions look like over the last couple of days. This team will identify what those critical contacts look like, and they will start to name students or employees who may need to be excluded as a result of that contact with that student. When you are identified as having contact with somebody, you will also receive a Department of Health letter that says, hey, if I'm a student or if I'm an employee, you've had that contact and you need to be out for this number of days, so letter will go home. And if you are a positive COVID-19, you need to self-isolate for 10 days since one of two things, either since the date of the test or since the date of the onset of the symptoms. And the case manager, in this case, Susie DeBose or Aaron, those case managers that we've identified, will talk directly with that employee or to that parent and inform them, what that looks like in terms of self-isolation. Okay? And in these cases, when you are either exposed to a positive COVID-19 or you are positive COVID-19, you can't test out and come back. You just have to stay out for that amount of time. Okay, there's no way to have testing bring you back earlier. So if I'm a positive test, I'm out for 10 days since the test or since the start of symptoms. And if I'm a contact of Jody Dumas, who was in the classroom, I don't have it, but I'm a contact identified by our contact tracing teams, you have to stay out for 14 days since the last date of contact, okay? Just like if you're sick, we've inserted into this process the letters that would go home that say you are isolated you're quarantined because you've been in contact with somebody who's a positive case. And just like when you're sick, we're going to require that at the end of that 10 days, if you're the positive person, or if you're at the end of the 14, if you were the contact, you cannot come back to school or come back to work unless you've gotten the clearance from the health department. So in these cases also, we feel very good about making sure to everybody else who is still at school, still at work, we're still learning. This is, we're still focused on what that looks like at school. We can make as confident as possible in making sure that they get cleared through the health department before they come back after that quarantine period or isolation period. And again, when they come back to school, we'll be looking for those clearances from the health department. So hopefully, we're going to try and make sure we get this out as much as possible over the next week to students and families and employees. It helps me kind of isolate sick versus COVID, positive or contact, and kind of really lays out, I think, what those steps will be. Also, on the next slide, we looked at them a little bit earlier, but the letters will be going out to clinics across the district, to clinic aides, nurses, so that they understand what this looks like, and so that these letters go out appropriately when they need to. And then we'll be working very closely with Michael and his team to make sure that those releases to come back to school and to come back to work are being processed quickly. And Ms. Brown, I think it was you who mentioned, could you email these? And absolutely, we were having those conversations yesterday about what's the best way to make it easy for families. And so I know Michael and his team are talking about email and things like that. And if we have families who don't have that, then he can deal with us, and we'll get the letter to the family to make it easy on them. So again, a few changes, but I think they're good changes because it really puts some I would say some checkpoints in place from the Department of Health before you can come back into school or come back into work.
So to clarify, I see that there is that phone number there, and they don't have to go to a doctor. They can make that phone call if they've met all those things, and we can get an email or a text message from the Department of Health?
That's correct. And Michael, I don't know if you want to jump in, but that's correct. So if you are a COVID contact traced person, you've gone through that process, it's either 14 days or 10 days. After that period's expired, you're going to call that phone number and talk to the health department. Now, they're going to want to make sure not only that timing has gone by, but they're going to want to make sure there's been an improvement in your symptoms. And so, Michael, I don't know if you want to talk to that a little bit, but that'll be another check and balance before they issue that return to work or return to school letter. Michael?
Yeah, to build on that, so for cases, whether or not they are for individuals with symptoms that haven't been tested, when they call us, we'll review when their symptoms started, and so we'll know the date that they can return, and we have a letter drafted already that we can personalize to that student or staff member and email to them to show proof that they've, on a specific day, they've completed their 10 days of isolation. The same would apply in the situation for someone who's symptomatic or asymptomatic and tests positive. Same process would be 10 days from the symptoms or their test. Once again, a letter would be provided with the date of their return. In the event that they are a contact, once again, they would reach out to us. That's a 14-day quarantine period. And we have a different letter or similar letter that's already drafted and could be personalized and emailed to those individuals. Unfortunately, we cannot text these just based on state guidance, but we can email them. That is not an issue. If the parent wishes to pick a hard copy up in person, that is fine as well.
Thank you.
All right, next slide. All right, thank you, Denise. Denise will take us through this one.
Good afternoon, everybody. So Dr. Asplin went through basic our enrollments as of last Friday. So coming back to traditional school, 70%, remote instruction at the traditional school, 28%, and then 1% each transitioning to homeschool or virtual school. That means, my glasses are fogging up, that the transition is based on whether they transition from last school year to this school year. This does not include charter schools either. So questions on these numbers?
Jane?
I have a question. Why no charter school numbers this year?
We didn't collect that information as of yet. We could collect that in the near future.
They're not,
and let me also,
they're not feeling love. That's why I'm asking.
Okay, we'll make sure they feel loved. We'll start looking at their numbers as well. But we also just got a report out and built where we collect this information, and it's just recent, within the last couple of days, where they can indicate on the registration forms whether they intend to be a remote student or a traditional student.
Eric?
Well, Dr. Denise, so last time we got this type of information, we were told how many FTEs had dropped off. It was 1,800, and you said it was 500, being processed. And so where are we at with that number?
Well, the best I can tell you as of now, and I also want to clarify that these numbers are changing daily,
I understand.
so we're not really
I understand,
there.
because last time it was in flux too, and I assume it's still going to be in flux. I just want to know
I would
what
say
flux are
that
we
our
in?
5 and 10 day count will be interesting this year, going back and forth. But these numbers here in the top 2 rows are really where you're seeing, because we looked at who transitioned into those programs. So that's where, if you're going to losing dollars here, that's where you would say, because those that are remote, I'm only counting the ones that are at our schools, so you're not losing anything there.
I'm sorry, I didn't hear the number. What number did you say of FTEs we're going to be losing? Last time was it was 1,800. How much was the number this time?
I don't believe that I gave you that number.
Mitzi gave us that number, but it was in the context of this chart, and so I'm trying to understand in the context of this chart, how many students have decided not to come back?
The top
900?
2 rows, if you look at the 479 and the 440, that's what you're referring to. Those are the FTEs that we would be losing, or the kids that were our students and are now going into the...
I was referring to the kids who are kindergarten kids who are less than last year. I'm referring to the kids who've decided to go to private school,
and
decided not to re-register. And last time it was 1,800. What's that number?
I'll have to follow up with you, because I really don't know how many kindergartens have not registered yet. I can guesstimate based on last year and try to determine if any of those are kindergartners here.
Okay. Thank you, Denise.
You're welcome.
Bridget?
Well, my questions, I think, are pretty similar to Mr. Robinson's. I think, I think we always aggregate our, numbers of students and even staff. So we have, 43,000 students and 5,000 employees as the, numbers that you constantly hear. So when I saw this, the numbers alarmed me, but then clarifying that charter schools are not in there. So because I'm not familiar with our enrollment outside, carving out charter schools, what do you have? I mean, I don't need an exact number, but ballpark, where are we?
About 6,500 students go to charter schools.
6,500? Okay. All right, thank you.
Shirley?
I asked for, and I thought we all received a report yesterday that talked about what the enrollment was, not versus last year, but what was the projection. And for total elementary, they projected us at 15,520, and we've got 14,119 or 122 now, and there's still 674 pending. And that looks like we need a teacher reduction of 78, but I think that's before the 674. And then it also shows what the positions were held out, and it shows that we had projected a enrollment of 6,600 for charter schools, and they currently have 6,086. So they're 515 below projection, and we've got it for the other schools, the high schools. And it's surprising that we have a few middle schools that are over projections, and some high schools that are over projection also. Sarasota and Venice are over our projected numbers, and even Booker is a little over. So I'm surprised when we get to the middle and high schools how we may even be over projection. But that when you look at the line that has the teacher reduction on there, does that already take into consideration the teachers that have taken early retirement and leave of absence? Is this what teachers are left?
I'm going to have to refer to Mitzi, because I believe that's not my Deanne Lattin's chart. Is that the one? Deanna?
Yeah, that's the report. I had fun working mine to get it all on one page. I mean, each set of schools on one page.
So what we've been doing is monitoring the enrollment that's in our student information system and what enrollments are pending in our student registration system, InfoSnap, to determine if we're going to be over or under. So this just takes into account teaching units, not necessarily who's sitting in those units. The number of frozen or held positions, I believe, does take into account those who have taken a leave. because we are not reposting those jobs if they have chosen to take a leave. Now, Danielle can correct me if I'm wrong, but these are just based on units and where we think we'll be. So right now, and we are also verifying certifications of some of our elementary teachers to see if they could be put into any of the middle or high schools if they hold the right certifications.
Yeah, because it looks like you're going to need some teachers in high school.
Correct.
And even in the elementary, when you look at what's held versus the reduction of numbers that we're expecting, you know, we still might need to reduce some or move them around.
Correct.
So
That's what occurs during the 5-day count.
I appreciate this, and I guess we look at this every year daily.
Every day.
From now until October, I would assume.
Well, that will be Dr. Asplin's visit job to make sure that that's all done.
Thank you.
Okay.
All right. Next slide. Al. I'll take us through this one.
Hello. So basically, as of yesterday at noon, these are the numbers that we have compared to last year in the different categories that are listed. Retirements are up a little bit, as we reported last time.
Al, is your mic on?
So I have to start over? Just joking. As you can see, the numbers that we have here, these are up to date as of yesterday around noon. We have, as you can see, the retirements are up from last year as we reported last time. The number of leaves, we did extend personal leave options on 3 different times. So the number of personal leaves are up, and those are leaves for 1 school year. The number of medical leaves are down from last year, and we added a little category into this year's where I put next to their 5 full year and 5 or full year on instructional, and that just means that those people did put in for the full year of medical leave, however, will qualify for FMLA for the first 12 weeks. So typically we don't fill a position with somebody who's on FMLA. And then childcare leaves, there's no real increase there. It's about the same as we've experienced in the past. So we've pretty much, our calls about leaves have pretty much gone down. Most people, I think, have made their personal decisions on what they're going to do. We've worked with just a couple of people who continue to ask questions about their options. So we are working with them, but there's not very many. I think these numbers have pretty much stabilized since we put out the guidance last week for personal leave options, and then there was also some just discussions about the medical leave options.
Al, what I'm getting still is some of the teachers are wondering if they're on leave right now, they would rather come back.
We have had a couple. We have had a couple, and what we had put out in an initial when we put out about the leaves was that they would need to follow the early return from leave procedures. So we have had about 4 who have done that, and so that's outlined in contract language of how they do that. And so we've had about 4 that have come back.
Okay, that's good to know. Jane?
I continue to get questions about leave of absence and concerns that we're doing something we shouldn't be, or we're doing something behind closed doors. I've had a conversation with the union, and I haven't had a conversation with you, but I understand that you made a decision that July 31st was the last day of a leave of absence for personal reasons. Was that correct? Was that the deadline?
That wasn't my decision. That was made with, I believe, Jody and Mitzi with the union.
Right.
Yes.
Well, I mean,
yes.
Meaning
yes.
us.
Yes, we did.
But it was July 31st, correct?
I believe that was correct.
Now, we didn't change that after. Did we change that or change our mind or offer some people a different plan after that?
No, what we did do was if we had some people that were in the works at that time, we have accepted their personal leave after July 31st. That if they were in the works with us making those decisions up until that date.
And let's say today if somebody wanted to have a personal leave, they could come in and get one?
Well, people could still, we have a provision in the contract language that applies for personal leave under emergencies. So it's just an additional form that they could fill out saying that it's an emergency, their situations have changed,
Yes.
or their thought process, and yes, we would still process those.
And a medical leave. The difference between a medical leave and a personal leave is a medical leave, you must be under the care of a doctor.
That is correct. So there's a part of the form, an application process that the doctor would fill out for the medical leave with the duration of the leave on there.
And if I'm anxious, is that a qualification for medical leave?
As the doctor says that it is, yes.
Okay, and it is open-ended in that the doctor may say in 24 weeks or 5 weeks or whatever, that I'm okay to go back?
So on the medical leave form, the doctor does put an expected time that they would be out, and if that changed, then they would need to have a doctor's releasing them back from their medical leave if it was earlier than that original date.
Well, I know there are people who are scared who have gone on personal medical leaves and others who are thinking about it. I just hope that we can, in some way, not penalize them for being out on a personal leave, do all that we can to make it easy for them to come back should they want to. You know, I'm looking at not just 2020, but 2021 and how our school district fares in the next couple of years. And so I hope that we're kind and gentle and all the things that we talked about being last spring with our students. I hope we're going to do that with these people as well, because I think there's still some misunderstanding out there. Maybe we need to put out another memo to our teachers, perhaps a joint memo between the union and you, Al, to discuss the parameters of this again, because, you know, I know that everybody's working very hard to do the right thing by everybody, but this just keeps coming up, and there are lots of struggles that people have now with trying to decide, you know, am I going to be safe? Are we going to be safe? We know the pediatric numbers are rising in the state of Florida. We know they are rising here, and so I just hope we can perhaps, Madam Chair, if with your agreement, I think it would be a great idea if we put something else out to these people again.
Okay.
So that there isn't any misunderstanding.
Yes,
Dr. Asplund.
yes, ma'am, we will do that. We will put something else out.
I'm learning. I'm not doing anything.
Well, I know
He's doing it.
you can then direct, so I was...
We will, and we also want to make sure that we clarify the 80-hour rule from the federal government. So we'll put all that together and send that back.
Yes, please. Thank you.
Shirley?
Well, I would think hopefully that when our teachers are feeling more comfortable about coming back will be the same time some of those students who went virtual will be coming back. And I would hope that maybe in October, when we see how things go, we might be able to make some changes. I am concerned about the number of classified. Are we going, because we get the list of teachers, but what about the aides and the ESE classes? What about the bus drivers? What about the custodians that we need so much right now? Is there anyone that can give me numbers on those?
Aren't they all included in our personnel report that we approve?
No, it's that we've got a lot of retirement and how many
Yep.
aren't filled. And as it is, even our custodians, there's a lot of unfilled. Do we have enough bus drivers? Do we have enough aides?
Mr. Dumas.
So thank you. That's a great question, and I will say in some cases yes, in some cases no. I think Dr. Asplund and I, one of the things we've talked about recently, I know Mitzi and Dr. Kingsley and I, Ms. Corcoran, excuse me, is staffing in certain areas. And so one of the areas we know we are short staffing. We always seem to be, but we're short, especially this year, is custodial. And that's just a reality of where we are. So Danielle Schweid and her recruitment team are on that full time. We've been looking at some options for a local organization who may have some help for us through a federal grant. And so we are actively recruiting, actively bringing on people as fast as we can. I know Jason Harris, Director of Transportation, has called every bus driver and called every aide. And we do have some people going on leave, but we're comfortable. We'll bid every route. What day one looks like, I can't guarantee yet, but we're more comfortable there than, say, custodial. So I think in every area there are some concerns, But I think most of all at this point, I'm feeling like custodial would be the one I'm most concerned on. And again, what are the options? So we look to other departments. So for example, on custodial, we'll be working with Mr. Harris. If bus drivers are running routes and we can get them to, right after their morning runs, they've got a layover. We run them to a site. If they're willing to do it, we teach them how to do some custodial task force, how to clean touch points. So that's added labor on the day shift. In terms of food service, some of the things we're looking at, when we turn cafeterias around, at the end of the day, that'll take an hour and a half for the custodial team. We're going to look to food service. If we can get volunteers to work a few extra hours, we'll teach them how to turn those cafeterias around, frees up custodial time on nights. And then we'll have to look at other things, like can some maintenance people work over in some schools that we're short. So it's going to be a challenge, I think, in several areas. I believe we're on it, and we'll get the job done where we need to.
And on the custodial, I'm already getting some concerns from some teachers who had some training yesterday and were told that you're going to have to take your garbage and put it outside, and you're going to have to wipe the tables at night. And I suggested to the teacher, well, maybe you can appoint a student to take the bag and put it in the hall. And she's, oh, the kids can't touch anything. And I'm
Shirley.
like, I don't know, where is that going?
Shirley.
What?
Eric and Bridget are waiting, and you were done.
It had to do with the custodians.
But you're not supposed to do that. You have to cue in. It's the only way I can control this. Eric?
Thank you. I am happy looking at custodians because they're the ones who are going to have the greatest impact on people feeling safe and secure. People see that people are going around doing these things, they're going to feel safer about their environment. If they see less people going around cleaning, they're going to feel less safe. And so I think it behooves us. I know a lot of people in facilities used to be custodians. That's how they work their way up. So any type of juggling you can do would be greatly appreciated. On a second note, there's a saying, plan for the worst but hope for the best. I think you guys also need to plan for success. Picking back on what Goodwin was saying, if we're doing a lot of things to relieve people's fears, if the numbers are going down, positivity rates are going down, you may have teachers who are changing their minds. That level of fear and anxiety that they may have had at the end of July, you guys have made, not you, but you and the staff and the custodians may have relieved a lot of those fears, and now they may be willing to come back. And, I'm hoping that you guys will have an avenue to, allow them to come back. I know it's contractual that Al had to talk about, but, I understand sometimes you plan for the worst, hope for the best, but you guys need to also plan for success. Is that, do you guys have the flexibility to do that?
Yes.
So I would echo what Dr. Aspelin just said. I think the answer to that is yes, and where we have to partner with SCTA on that. Obviously, we want great teachers in front of students, and so we're going to do everything we can to make that happen.
And I asked earlier about the was it OmniShield or OmniGuard? I forget which one.
OmniShield.
OmniShield. How many have you in, and if not, when will you get those in?
Perfect question. So it came in late last week. They sprayed over the weekend. I believe they got 4 schools sprayed, and so that was a good trial weekend. So we know how quick we're spraying versus how much time we have left. So they will be spraying every night throughout the weekends coming up. We'll have everything done to start school. Again, once teachers leave, we're spraying second shift now because there are teachers in classrooms back. So we moved to second shift, but they'll be done to start school. Everything will be sprayed. And again, just to reiterate, what Dr. Aspelin said in his opening statement, I think that's an added benefit so that we've got that antimicrobial on every surface, door handles, desktops. We're even going to spray, and I wasn't sure that we could do this, we clarified, yes, we're going to spray gym floors. And so when students, if they're doing push-ups, that antimicrobial is on the gym floor. So we're going to use it everywhere we can to be that kind of that last.
And are we going to be using those battery-operated dispersing mechanisms?
Every day.
Every day. So do we have enough of those items?
So we've got at least one per site, and so the goal is during the day we'll use those to turn cafeterias really quickly, so we can spray tabletops, we can spray seating, and then at night where equipment like that becomes very, very useful is if you do get short and you have to start prioritizing. Certainly the things we're going to prioritize are bathrooms and touch points. We can put a person on one of those sprayers and we can knock off a building very, very quickly with touch points, and so that's where that technology will become very, very
I think if people see people using those sprays and touch points throughout the day, it's going to make people feel more comfortable. I would actually even have people outside as people are dropping off, seeing people with that spray. I mean, you guys got to fight public perception and reality simultaneously. So I strongly suggest that you work on the public perception and the staff and teachers' perception along with the reality simultaneously.
Before I call on the next person, I want you to know that it's 5 of 2. We have to talk about face masks, which I think is going to be a policy before we break for a meeting. So just be aware. Bridget?
Thank you. So a couple of things. I agree with Mrs. Goodwin and Mr. Robinson on certainly the concerns are there. I know operationally it's a real delicate balance because we want to extend the LOA, and I recognize, particularly as even the board, to Mrs. Zucker's point, if we are changing decisions, that changes people's decision on whether they want to take a leave of absence or not on either way. Right. And so I think going to Dr. Brennan's point at the beginning is, once we make this choice, we move forward, but then moving ahead to Mr. Robinson's point is plan for success and trying to think through that operationally, because I know it's not easy as flipping a switch. You have people filling these positions. So however we communicate that and however we can realistically do that, obviously you'd want to do that, but there is an other side of it. But the other part I wanted to really thank the SCTA. I am really impressed when I compare across the state and the country. I read the newsletters that you guys have put out, and I just want to say thank you, because I think that it has been in a manner that is in a very uncertain time. I think that you have shared information in a calm manner. It doesn't necessarily mean everyone agrees with it, doesn't necessarily mean you all agree with it, but I think that really just helps us navigate an incredibly challenging time, and I just wanted to say thank you. So,
Shirley.
Well, on the taking out the garbage, if we could maybe work with the SCTA and someone and send the letter out to the teachers, explain why we're short staffed and how this might help. And I don't know if a student can pick up the bag and put it in the hall or not, but this OmniGuard spray that you've got too, why can't we use that on the playgrounds? Because I've heard from teachers too, if the county playgrounds are open, why can't our school playgrounds be open? Can we use the Omni spray on them?
Yes, I would predict that we could. I'll have to verify that, but I'm pretty sure we could spray on the playgrounds and then open the playgrounds.
One thing we need to be sure of, too, is the fact that we have purchased a certain amount of it, and we need to make sure we spray inside first, and then we'll work outside.
Yeah. Thank you. Move on.
All right, the next piece is we have a couple of videos that we wanted to show you, and if we have time. Do we have time, Madam Chair?
Yes.
Okay.
They're just going to be short and a face mask.
All right.
I'm Laura Kingsley, Chief Academic Officer for Sarasota County Schools, and I want to thank you for taking the time to join me today. I'm hoping that in this video, I can help you see some details about what instruction can look like when we return in the fall. You will be able to better envision the classroom and imagine the positive possibilities. Because of the 5 additional days that our staff will have before students return, our teachers will engage in collaboration with their peers to create wonderful, rigorous, standards-based lessons. Every student will be taught these lessons throughout the school day by their classroom teachers. Our classrooms are equipped with nimble little cameras and microphones that allow the teacher to direct the camera to the active panel or to themselves so that they are teaching both children at home and children in person. Our teachers are tech savvy, and this technology they will learn so quickly. The classroom is going to be equipped with barriers. A teacher can be in front of the barrier, beside the barrier, where children and the teacher can collaborate on learning back and forth for whatever the assignment is at the time. Children who are remote learners may be part of a class filled with other remote learners. Everyone will log in as directed and follow a school day with their teachers on their device. In many other classes, remote learners will engage in learning with in-person learners. Teachers may share their active panel or focus the camera on them as they direct learning for the children in front of them and those visible on the screen learning from home. This is what we're calling concurrent teaching. The concurrent teacher's classroom will maintain class size requirements, but they will have fewer students present in the classroom. Flexibility is the key for so much of what we're about to go through. And if teachers and parents find that their child is not successful in a remote learning environment, we absolutely want to transition back to face-to-face learning in the classroom. We're still dealing with lots of unknowns. And at any point in time, we may need to spontaneously move to remote learning. I want everyone to know that our teachers will be prepared to transition to remote learning quickly. All parents will be asked to sign a letter promising to fulfill the expectations for both in-person learning and remote learning. You will be asked to screen your children before they get on the bus or come to school. If we are having remote learners, parents will be asked to ensure that they are creating success in their home for their child, setting up their environment so children can learn, making sure that there are no interruptions, and honoring our teachers by not recording anything on the lessons during the day. Our district staff has worked without ceasing for nearly 6 months in order to get the very best to you. We promise to continue to work through every challenge and problem solve to make this extraordinary time in our history as manageable as possible.
Good job, Laura. I know you stress. Good job, Gemma.
Hi, I'm Sarah Dan. I'm the Director of Food Nutrition Services. Our staff is excited to have students come back. We are taking the safety of our students as they come through our cafeterias very seriously as we go into the fall. One of the things that Food Nutrition Services is really making sure that we're providing for our staff is PPE, so that when we're preparing the food, when we're serving the food, we're just keeping our staff and our students as safe as possible. Students will be social distancing in the line. We have already marked the floors in all of our locations so students can space. We are also asking that our students wear their masks through the line while ordering and checking out with our cashiers. We've been working with each school administration to try to make sure that we are helping them in their meal service plan and tailoring that to help in serving students quickly and safely as possible. So they'll go through the line, sanitizing as they enter the line. They'll select their own entree. That entree will be wrapped so that it's touchless, essentially, and then go to the checkout area where they'll have a card that they can scan their information in. They'll need to say their first and last name to the cashier, and then they'll be able to go on about their day. And not to worry, if a student forgets their scan card, they can enter their 5-digit PIN number and then sanitize prior to going to eat their meal. One of the safety features that our department will be doing is periodically throughout meal service, they'll be sanitizing touch points, whether it's the tray line, slide, or the railings, or maybe the pin pad periodically throughout meal service. We want to do that so that we're continuing to take student and employee safety seriously. Not only will we be providing for our students that will be on campus, we are also providing meals for our remote learners. Those families will be ordering those meals the Thursday before, and then they will be picking up at their school location on either Mondays or Tuesdays. With that, they will get a week's worth of food, so they'll get 5 breakfasts and 5 lunches. Everything will be charged to the student account based on the student's status. So if the student is free, the meals will be free. If they were reduced, they'll be at a reduced cost, and then our full paid students will have to pay. We will be doing a car pickup service with that. So a parent would come to the school, have to show student identification, and get those meals for the week, and then they can go back. Their student does not need to be in the car. They just have to have proper identification. We normally provide restaurant quality food. That has not changed. What we have had to do this year is just streamline our choices. Our menus will be posted on NutriSlice. There's an app available to know what's on the menu each and every day. Still have our standard commitment to nutrition, integrity, and really making sure that we're providing items like fresh fruits and vegetables. We know how important nutrition is in the overall learning and success of our students, and so we want to do our part to support families and students as they come back on campus. We care a lot about the students that we serve every day, and we're just committed to their safety and keeping them well fed as they go back to school.
All right, that would conclude our report on the opening update.
Those were good videos. Thank you. Good job. Are there any questions before we move? We're finished with this section,
All right. Okay. As you were saying, we are at the point now where we are implementing our plans. So it feels good to get started working with and on some of the things that we have planned in the past, and we're moving forward, especially starting yesterday with some of our training. Our next item is our mask policy, and I know that over the last few weeks, it has been a struggle. We have had different information coming in from different folks and from different agencies and so on, also working with the Department of Health and Dr. Goodil from Sarasota Memorial, our infectious disease specialist. We've asked quite a few questions and trying to nail down what we should do with the mask piece. I know we had a policy that we had talked about before, and I believe was voted on before, with new information and the fluidity of everything that is going on and has been going on for the last 3 weeks. We did make a few revisions to the policy that we wanted to share with you today. And these revisions that Mr. Art Hardy will be reading to in just a moment is the recommendation of the superintendent that you move forward with this policy. One thing before you do that, I did want to bring up some other information that I received today, and I don't know if you saw this today. This came out of the USA Today, and it talks about a couple of things. The body of evidence here continues to grow that masks protect not only those around them, but also the person wearing them. With so many choices, what's your best option? And then it talks about that this sheet here. So the researchers ranked more than a dozen different types of masks on how well they might protect wearers and those around them from COVID-19. And when I look at this list, there's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 out of 13 masks that all reduce the spread or stop the spread of particles 100% better than not having a mask, obviously. And these masks all look a lot like the masks that we're all wearing. And they're different kinds, just to name a few. I just want to make sure you have this information before we have this conversation. But the fitted, obviously the N95 mask, but also the 3-layer surgical mask, the cotton polypropylene cotton mask that looks like this as well, the apron mask, the 2-layer pleated style mask, again, looks a lot like this one, the valved N95, the Olsen style mask that looks a lot like what Ms. Brown is wearing over there. Then we have the AT mask, the 1-layer pleated mask, the 2-layer pleated mask, all of them that look a lot like this and a lot like what you're wearing. And they were rated from 0 to 1.5, and the masks all these masks fall in the area of a 0.2, 0 being the best at a 0.2, and then not having a mask is up in the 1 to 1.5 range. So obviously from these researchers, having a mask is definitely important. The ones that came in as not faring very well were, number one, the knitted mask was about halfway down the scale. The bandana was also around halfway down the scale, around 0.5, between a 0 and a 1.5. And then the neck fleece or the gaiter, that actually was up in the 1.3 range, which is higher than not having a mask at all. And it's hard to understand that, but what it says is the gaiter ranked worse than no mask at all. And it could be because the porous fabric may break the larger particles into smaller ones, and smaller particles remain in the air longer. So I thought that was very interesting, and the reason I brought that up is because I've been getting a lot of questions about the gaiter, and I know when you look at a lot of professional athletes wearing those and so on and so forth, and our students are watching those athletes, and so they're going to want to show up with those. But according to the research, those are not something that we want to have in our schools. We need to have the masks. So with that said, Mr. Hardy, our attorney, is going to read the policy with the changes that we made. And again, this is my recommendation to you.
Thank you, Dr. Asplin. There are really...
Your mic.
It's on. I'll talk louder. We've given you the potential changes or the proposed changes in red, and really there are 3 primary changes, so I'll just let you know what those are. Under the current policy, which is called face coverings, one could have a mask or a face shield and be in compliance. The changes are to change face coverings to face masks and remove the ability to wear a face shield as an approved covering, at least in the first instance. So the requirement is to wear a mask. The second change is in the medical certification provision. We have a medical certification that says someone couldn't wear a face covering. That's now changed to say you can get a medical certification for a licensed medical provider to say you can't wear a mask. If in fact you get such a certification, then you would have to wear a face shield as a secondary, better than nothing, a face shield, unless you also got a medical certification that you cannot wear a face shield. So if this policy is changed as suggested, there will be a form that people will get to be able to take to a medical provider to say, my patient, Art Hardy, cannot wear a face mask. If that's checked, the physician or the healthcare provider would be asked the next question, could Art Hardy, who can't wear a mask, also not wear a face shield? So the physician would have to check both those boxes for someone to wear neither. If it's simply a mask that they can't wear, then the person could wear a face shield. So face shields are possible under the revisions here, but only if you have a certification that you can't wear a mask. The third change is in the exceptions. We added another exception for instructional delivery, which says teachers may choose to wear a face shield instead of a mask when the teacher believes wearing a face shield is appropriate to effectively deliver instruction. So that would be only during the period of time when the teacher is affirmatively delivering instruction. The teacher would have the ability, in his or her discretion, to do that with a face shield as opposed to a face mask. But if the teacher were otherwise engaged out in the hall or anywhere else, they would be required to wear a mask. So those are the three significant changes that are being proposed to you.
Shirley?
What protections or what steps can a teacher take or a parent take if, in fact, there is a child in a class that is not wearing a mask?
Well, if the child is not wearing a mask with an exception, the child could be wearing a shield unless the child also has the exception for that. Assuming you have, and I would expect and hope that would be a very small percentage who would get a healthcare provider to sign off on both of those things. But assuming that were to happen, that child is still entitled to come to school, but the teacher, in conjunction with their administration, can attempt to, we can give them additional PPE to use, perhaps. The child may be put in, every area has a corner, or not like facing the corner, but as isolated as possible, not seated in the middle of the class. There could be additional wipes that are available. I mean, that's something that I know Dr. Kingsley and Dr. Asplin are working on with staff, but we can try to protect as best we can the other people in that room.
But a parent doesn't have any expectation of that kid being placed in the middle. That kid may be placed in the corner,
yes,
or far away.
Right. I think the understanding is that we need to do our best to mitigate that situation and create a safe place for everybody in the classroom. And I think during this time, people will understand that, and whatever that might be, and it might be a couple more desk shields instead of one desk shield. It might be a certain area in the room. It might be other ways to mitigate that situation in which everyone can still learn in a safe fashion. Now, if a student just refuses to wear their face mask or their shield, then and we have talked to them about it and they still refuse to do that and they do not have a medical certification, then they'll be asked to stay home and work remotely.
Good. Eric?
So, under number 3, 1 and 2, is that supposed to be, under, I guess, is that section 3, 1 and 2? Is that meant to be the definition of what masks are?
Yes, it initially was face coverings and now it's face masks.
Now, if somebody has a mask that's a clear mask, so they can kind of achieve the same goals of a face shield, but it's clear in its mask. Is that acceptable under these definitions?
I think that yes, it is, and in fact, it's my understanding that the district has purchased a number of those because that may be useful for educational purposes. Yes. But yes, as long as it's a barrier as a mask, it doesn't have to be blue or
because I can see people getting a little creative, especially because we're allowing homemade cloth masks.
Right. What we don't want, and what this covers, is it has to be made of a solid cloth material or other suitable solid material. So you can't strap together a doily and put it on your face.
Right. But the clear isn't cloth. The clear is
but it's as long as it's a solid material, it's okay.
Yeah.
Okay.
And to speak to that, Mr. Robinson, I know that Mr. Dumas has received a few boxes so far of the clear masks that you're talking about, which looks like a mask like this, but it is clear. And we received those, and we're looking at those. We're putting those on, seeing how well they work, and we'll be able to give you a sample of that so you can take a look. And
this is a request. It's not really a question, Madam Chair, but please be, understanding, especially towards the beginning of the year for the younger kids as this process gets rolled out, and be understanding to the teachers who are trying to enforce this policy, because it's going to be very difficult for the teachers, especially initially, and the shorter the time period from start, it's going to be harder, and the younger the child is, it's going to be harder. And so I'm hoping that you guys are understanding of that.
Yes, I'm glad you brought that up, because one thing for those parents who are watching, it would be great if you haven't already, which you probably have, but have your child start practicing a little bit with their mask before school starts. Get comfortable with it.
I have been amazed when I go into Publix and I see little kids wearing masks. They're in the cart with the little, like they're riding a car in the shopping cart. But I've seen little kids, and I mean little, preschoolers, all wearing masks. In church, them wearing masks now. So kids can do this. Shirley.
I've had a lot of discussions with a lot of parents and teachers about the masks, and I was making masks early on, and I learned a lot. And I brought a little demonstration of what I learned about how you can tell when a mask is good. And this is one of these gaiters. And if you don't have a spray bottle, you can just kind of look through it. If you can see the light through it, it's not going to be holding those materials. But if you put it over a spray bottle and go like this, you can see how much I don't know if you can see, but it brings everything through. You can take thin cotton ones and hold it up too, and even the thin cotton ones will hold some. It doesn't, not much goes through. And the cotton ones, this is what they call a knit. It's like 1 or 2 layers of t-shirt. And that'll get through and it'll get wet, and if you wear them enough times, after the first, but if you get a sneeze, whatever's sitting there will then come out. There are the N95s. There also is a non-woven interfacing. Some people are putting coffee filters in, but you can put a non-woven interfacing in. That stops the moisture from going through. If water doesn't get through, if you spray and the water doesn't get through, the particles won't go through. It gets warmer, it gets hotter, it keeps more moisture in, but you've got to wonder, for each of us, make your own decision. How important is it for me? Because if you've got a sniffles or you're cold, you got hay fever, you might want to make sure that you're not letting anything out, or if you have certain conditions. But if you have asthma and you have trouble breathing, something that might be a little easier to breathe through would be better. But hold it up to the light or spray the water on it, but you can see. And I know these were $25 a piece. It just went right through it. I was surprised to learn that myself. But that's why you do it. And if anyone thinks I did it, it's just a spray bottle. You can do it all on your own at home. And check your mask to see that.
Or did you want to speak? Bridget?
No, those are I just wanted to make sure you all knew what the changes were, and to try to answer any questions you have. The proposed changes will be on your regular board meeting agenda.
Is Dr. Gordillo still with us? Gordillo, I'm sorry.
He was in the middle of crowns, he stepped out.
Okay. So I've done a lot of research, and I think I speak for many people in the community where it's frustrating, where you can read a well-sourced document and it'll say one thing, and then you read something else and it seems to say the other thing, and it makes it incredibly challenging to make these decisions. So as I've said before, I know and recognize that proper use of masks, when you look at the spectrum of mitigation and tools to use that will reduce transmission, face masks are in fact, when properly used, are in fact beneficial. For me, and I think people are resilient, I think that if it's uncomfortable, there's ways to go through it. I don't particularly like it. I don't think I'm diagnosed claustrophobic, but I can't tell you, as soon as I get in my car, I'm very eager to take it off. My biggest challenge, as I've shared with Dr. Esplin and has said before, is particularly on the lower elementary K2. I think it is such a critical time for development. I'm very appreciative that within this policy there there is some accommodations made from the face shield to enhance that instructional aspect, but it isn't only the instructor that those students are learning from. It is certainly peer-to-peer at that time. And certainly it's near and dear to my heart as a mother of a lower elementary daughter, and more to come. So, but it's not just that. That's just my opinion, and I can teach my daughter to, again, the resiliency and the responsibility that we need. But from a true science standpoint, and I already touched on the instructional, and I have heard that certainly from members of instructional staff that are concerned. It's not that it's a hard and fast no, but it is a true concern because that's their area of expertise. But also from the medical professionals, the one challenge that I question is how recognizing the purpose is to mitigate the spread of transmission and also to keep others safe and yourself safe. And so when you're wearing it for a certain, that's why I wish if Dr. Gordillo was here, but if it's the length of time in which you're wearing it, and is it still continuously to be beneficial to the individual, or does it actually end up having a more negative effect? Same with touching and what have you. I recognize the gaiters has been a common topic, and I don't see, is that excluded? Because I recognize that so it is excluded, so gaiters are not going to be considering masks. Right. I just want to make sure because
I thought I read it in here.
A mask would be defined as Mr. Hardy mentioned, was Mr. Robinson, number 3. Let's see which one.
3, 1, and 2.
Right.
3, 1, and 2. That's how we have defined it.
I didn't know if someone could. Okay.
Now the part about the gaiters today, this was information that I received today about the research, and I just wanted to bring that up to you. So
no, absolutely. I just wanted to make, because again, from a communication standpoint for the community and for families, and I also recognize you're pulling it up, pulling it down, pulling it up, pulling it down, and so again, what are you really solving the problem or making it or exacerbating it? But then again, I go back to I have a real challenge, and I've shared this with Dr. Asplin, wanting to see if there was an option from the K2 standpoint, narrowing it in there, because that's where I find that again it's a critical time of development. I believe that I think it will be very challenging for 5 hours of the day. I probably am in the minority here, and I'm still going to share my point of view, but in the event that is the case and it goes forward as stated here, and I appreciate the recommendation, this is a very challenging one. My other question would be, as far as increasing recess time, outdoor time, we not only are our students to, again, for the bigger picture, and I recognize all of these mitigation tools, but they are not, when a normal year, which I can't even imagine what that seems like anymore, but in a normal year they would be transitioning from a classroom to classroom for specials. At this time they will be, and understandably so, in one place at one time for a long time. Has that been something that's discussed? Obviously I think there's a lot of innovation. We're fortunate outside of the summer months, November and on, to have outdoor instruction options. But is there an increase of outdoor activity to, again, just to allow kids to get out and move around, since that is not something they would be accessing and transitioning?
All right, Chris will answer that one for us.
That's a great point. Thank you so much for bringing that up. As I've been talking with administrators at the elementary level, they recognize the same concern that you're raising right now. And so, again, I think, as I commented in the last board meeting, they want to make sure that they take strategic and intermittent breaks. They definitely want to make sure. I've seen the maps and the plans of the campus. They're mapping out specific areas where classes can go out. They're really trying to be very, very strategic to go ahead and make sure that kids not only recognize the need, and so through education and practice and understanding why they need to wear it in the classroom, but as they transition to the cafeteria, to recess, possibly out to PE, et cetera, when they have the opportunity to go out to the field and take a break, they're definitely going to go ahead and try to include that.
Thank you. And then, again, going to water breaks, even sitting up here trying to figure out the appropriate way, and I think these are things we can work out through that, but From my perspective, again, and I didn't make this in isolation, it is after a lot of conversations with subject matter experts, both in medical and instructional, my biggest challenge is particularly on the K-12 area. And so I wanted to ask those questions of Dr. Gordillo, and again, trying to ensure the safety of our students. And I appreciate the work that's been done on this. I know it's not easy, but those are where my concerns lie. Thank you.
I think I may have given you the wrong advice. Is there gators in here? I thought it was in this policy.
Gators are not referenced, but they would not be, they would not fall within the definitions.
I know, but should it be in here and not to wear it?
I would.
Because it's going to, a lot of kids will do that.
So what you're saying is, since it doesn't say you should not wear a gaiter, others
That's right.
they
They would
may
think it's
define
bad.
this and think it's okay.
Yeah, that's what I was worried. If you read it, would someone, do you need to list exclusions, for example? I'm sure there'd be
If we look, that, of course, that's the problem. When you start listing things, you're going to leave things out. But if we know that there's one particular thing, like gators, that are an issue, we could have another portion to paragraph 3, where we have face masks, what are approved for compliance, 1 and 2. Then we have a couple of freestanding sentences. Anyone can use a face shield in addition to a face mask. All face masks and shield must comply with school dress codes. We could put in another freestanding sentence. Gaiters or similar coverings are not in compliance with this policy.
I would say gaiters or bandanas.
Yeah, bandana.
Or buffs. They're also called buffs.
You're the only one that calls them buffs.
I haven't heard that one.
Well, that's what they call them if you fish.
Oh, okay.
When do you fish? Jane, you're up. Sorry.
I think, Jane,
is up.
I'm sorry.
I think it's a great policy. Thank you. You included some things I didn't think about. I think it does allow flexibility for the younger grades, K through 2. And I think phonics and seeing the mouth and seeing pronunciations of things is important. I've had several parents who have reached out to me as well. But I think this gives the flexibility for the parent in the individual situation with a child or a schoolroom to work accordingly. And yes, I think there will be plenty of time to take breaks, hopefully, and to get outside and, once it cools down a bit. So I'm happy with this.
Shirley?
I am too, and one suggestion I'd like to make is perhaps children bring 2 masks, one in a baggie to have in the afternoon, because the cotton ones or the other ones, they do start to get wet, and if in fact you would sneeze, cough, or something else, or say petunia after you've eaten cookies, your mask might get dirty, and just having a fresh one after the lunch period might be helpful. But put that in a baggie so that the other one can get put in a baggie and taken home. On that same area, though, because not all face masks offer the same protection, you go to the air quality in the room. And that is something that we've been talking about, the movement of the air. And if Jody can touch on how much air is coming in and how often the air is being turned over in the classroom, because that's another issue that I've been called upon to respond to.
Sure. So as we've kind of learned about COVID-19 in classrooms and buildings, one of the things that the recommendation is to look at your air systems and make sure, one, you're flushing with outside air as much as possible. So our systems, our technicians have, over the last several weeks, been going around and verifying outside air damper actuation. Means they're actually working like they're supposed to be, and in some cases setting them, because not all are automatically controlled. But in every case, our goal is to bring around 20% outside air in at all times, so that your air handler is constantly mixing indoor air with outside air before it goes back into the classroom. And so we will be flushing classrooms between 5 and 6 times per hour is our goal. The balance of all that is maintaining space temp and space humidity as you bring outside air in. So it's a little bit of a fine line, but that's where we should be in classrooms, as well as we've had the questions, portables have that ability too.
And you will allow teachers who have asked to bring in a HEPA filter or the UVC filter, or some of them are even bringing in little tent-like things with PVC pipes and shower curtains, and within reason, I would imagine.
Yeah, so, a lot of our teachers, our staff are very creative and doing whatever they can to make their classrooms as safe as possible. And so that includes some of those items. In past years, we've said, no, we're not going to allow those in classes. We have said, yes, we're going to allow all that. And we'll treat it kind of as an exception. If there's a complaint or an issue, then we'll go and take a look at what's coming in. But for the most part, we're accepting those items into classrooms.
And that brings up the second question. Should we have teachers out there begging on Facebook and whatnot, please, give me the $160 or $200 to buy this? Or is this something that we should be looking at purchasing? And I know we've had discussions on what size is the room, what size is the thing, and I want to continue those discussions because I want to, do everything we can to make those rooms as safe as we can for the students and for the teachers.
Art?
I just wanted to tell the board that we will add, based on the conversation, another sentence to paragraph 3 that says, gaiters, bandanas, or buffs may not be worn as an alternative to face masks. Is that acceptable?
That's good. I think that's good.
All right. So when you are considering the draft policy at your meeting, we'll need to remember to include that language
Okay.
in the motion. If you call on me, I've got it written down.
I'm going to call on you.
All right, thank you.
Bridget?
Thank you. One thing Mrs. Brown brought up I think is important was the length of time of which they're wearing, and so I'm glad you brought that up. One question I have is, as far as waivers, that would be required then by the start of school. Is that correct?
Yes, so we are right now putting together a form for that purpose.
Okay.
Actually, we have it already. And we've also created, Mr. Dumas, you might want to come up here and talk through this, but we've also created plastic cards that we will hand out to the principals to have ready, so that what we'd like to see happen was when a student turns in a waiver, they would receive this card, and there would be a spot on there for us to either check off or click whether it's no mask or whether it's no mask and no shield, so that the teacher and anyone at the school site, if we needed to ask the question, they'd be able to pull this card out and we would know. We will have it in the office too, so we could always check that way, but if the student has it readily available, that would be helpful. The reason we wanted to do that is because we know there'll probably some students who are just defiant and not wearing anything, and we need to be able to handle that situation as soon as possible. So we put that together, and we will be, right after our board meeting, we'll be putting that information out so that parents can then take advantage of that and get that taken care of so we can get it done before school starts.
Very good. And then in the event there is, and I imagine a number of them would already, whether it be on their IEP or 504, we probably have access to that information for the most part right now. But however, there may be certainly some other students that wouldn't be in that realm, but that would fall into this case. However, the incident, and I think you may have touched upon this, but I didn't want to, I don't want to overlook it, is that in the event that waiver exists and there is another student or employee that is of a higher risk factor, those are going to be handled, I know those again at the classroom level, but I'm assuming administrators can be evaluating something like that. So that again, okay. And then the final question, comment is to what Mrs. Brown also said is, I love this community that when you see there are so many people, even in an economic challenging time, are still very eager to help support our teachers and our staff and our families. And I would support that. What I think is important that we don't want to duplicate efforts, because as a community come together and find those places. And so I don't know even how that possibly is the best way to achieve that, but I've certainly had people reach out to me and say, is the district doing this or are they doing this, to Mrs. Brown's point as well. And so I just think that, again, as a community, we don't want, if we're handling it and then a nonprofit starts to support whatever that may be, if you see that, I think it would be wise to kind of jump in at that point. So that's all. But thank you very much.
Okay.
Can I respond to her?
Yeah, sure.
On that point, one of the problems is if the community is helping, I think the teachers, the parents of students at some schools, say Ashton or Pineview, are more apt to help those classrooms than some of our other schools who may even need it more, such as, in some of our Title I schools, or even, Oak Park. If we can get air quality circulators in those classrooms at Oak Park, or even any of the ESE classrooms, I think we need to look at that, and I know we're looking at the size of the rooms. I had a teacher told me today she had a 10 by 10 room, and I'm like, yeah, I asked her to check the numbers. She didn't get back to me because I can't believe there is any 10 by 10 classrooms. I think we talked, and they're 800 to 1,000. And a lot of these machines they're giving us of how many it works in a 500 square foot or 400 square foot. So the numbers don't jive. So, we don't want to buy something that's ineffective. But at the same time, if we know that there is an issue in a classroom, we need to address it. And if the parents can't do it, we need to do it in some of these classrooms, in my opinion.
Do you want to respond? Brennan, do you want to?
Just a response to that would be yes. As we get started and we start to implement these processes, we are definitely going to be looking at what is not working and try to come up with solutions as best we can. And I can tell you, just in the short time that I've been here, Mr. Dumas and his team are pretty amazing about getting things done and very quickly. And I appreciate that. And so I know he will take care of those situations to make sure that our employees and our students are safe.
All right, any other questions?
No, none.
If I could just say one other thing, I just want to I want everyone, and I know there's a lot of people listening to this out in the community, I want everybody to recognize how difficult of a situation this has been for the board. You all are the ones that are approving whatever policy it is. And there are so many different points of view, especially on mask, so many different pieces of data. Even doctors, it's hard to get everybody right on the exact same page. And so knowing that you're not going to please everyone, but you have to make a decision, I truly think this is the best decision for you to make, considering the safety and welfare of the students and the employees. And I just appreciate what you're doing. I appreciate the fact that you're answering all the emails and the phone calls. And at this point in time, hopefully making a decision on this mask policy so that, again, we can move forward and be successful this year. So thank you.
Are there any other questions on this policy? All right, we are adjourned from the workshop, and we will be back here at 3 o'clock.
All right.
For the contact tracing stuff, you guys want us to see guidelines for close contact with like 6 weeks without